The Georgia Association for Primary Healthcare, also known as GAPHC, was founded as a not-for-profit membership organization in 1977 through the collaborative efforts of a wide-ranging partnership of primary healthcare associates. Through its history, GAPHC has engaged in a strong advocacy agenda to improve access to comprehensive primary care services for all medically underserved Georgians, along with supporting continued expansion of federally qualified health centers throughout the state. Our membership of health centers offer a variety of integrated healthcare services, such as primary medical care, dental, pediatrics, women's health, and behavioral health. 40 years ago, a mere 6 individual health centers, along with 10 clinic sites, existed during the start of GAPHC's beginning. Today, our membership organization has expanded to 34 health centers, comprised of 203 clinic sites, covering 111 counties throughout Georgia. This represents a growth of 100% in the number of healthcare organizations and 150% in the number of clinic sites over the past 15 years. Last year, Georgia health centers served close to 500,000 patients, which 28% of those individuals are covered under Medicaid, 11% under Medicare, 22% were patients with private insurance, while 40% of those individuals were uninsured, which accounts for 1 in 12 uninsured Georgians. In 2017, we expect to see close to 600,000 patients. Our membership of health centers provide quality healthcare services locally in an ambulatory setting, avoiding costly ER visits, preventable illnesses, and debilitating complications from untreated chronic conditions. In Georgia, the average annual rate of ER visits for uninsured patients is 25% less in counties with a health center compared to those without. Health centers comprise of an integrated, multidisciplinary team of medical providers and administrative staff who deliver high-quality, affordable, and accessible health care to underserved areas throughout the state. Our health center workforce consists of over 400 physicians and mid-level practitioners, 66 dental providers, 48 mental health providers, along with over 1,500 other support staff. As a system, we employ over 2,000 individuals. Health centers have helped to stimulate Georgia's local economy by creating over 3,000 jobs both directly and indirectly. For every 10 health center jobs, 7 additional jobs were created. In addition, we have contributed over $240 million annually to the state's economy. The Georgia Association for Primary Healthcare continues to strive for improving the well-being of underserved communities by advocating for the expansion and sustained high-quality health care for its membership of federal qualified health centers. As our organization approaches its 40th anniversary, we were compelled to renew our brand identity to make it easier for patients and partners alike to better understand who we are, the value of what we do, and the positive impact we have in local communities. Our core beliefs involve advocacy through educating policymakers and the public about health centers, the provider and employer of choice. Community represents health centers as local, nonprofit healthcare providers serving low-income and medically underserved populations. Lastly, we offer accessibility to integrative, comprehensive care for all Georgians. To celebrate our 40 years of success and growth as a top healthcare safety net provider, we present our new brand and logo as the newly deemed Georgia Primary Care Association.